afternoon, Dr. Berger.
Good afternoon, Irina.
We have been doing multiple videos in regards to heart and cholesterol and risk factors. What your blood pressure number really mean?
So I'm often asked this by patients. So those two numbers, 120 over 80 or whatever they might be, what's the meaning behind those? So the top number is called your systolic blood pressure. It's the blood pressure in the arteries right after the heart squeezes the blood out into the aorta. And the diastolic pressure is the pressure in the arterial system in between beats, so when the heart is filling. So those two numbers represent kind of the elasticity of the arterial system. And having those numbers be elevated is a big risk factor for cardiac disease, stroke, kidney disease, eye disease, etc. So it's really important for it to be controlled. In terms of what are the kinds of things that can cause people to have high blood pressure, of course, there's family history, but there's also a lot of lifestyle factors, including excess sodium intake, being overweight or having obesity, smoking, and other conditions. So it's important for you to know your numbers. The way to check it is to do so. I like to tell my patients, if we're only doing it once a day, to check it first thing in the morning before any caffeine, sitting at the kitchen table with your arms supported by the table, and use a arm cuff rather than a wrist cuff. Arm cuff is much more accurate. And you want those numbers to be ideally under 120 over 80. The recommendations used to be under 130 over 90, but because we have seen much better outcomes for both heart and brain if pressure is kept under 120 over 80, those are the current guidelines. So important for you to know the numbers, important for you to also be followed up regularly by a physician, to have regular blood work done to make sure your kidney function is good, your electrolyte numbers are good, etc. Thyroid function also important to know. Hyperthyroidism could lead to elevated blood pressure. So important to have a check-in annually with your doctor. But one of the most important things to know, your blood pressure. So if you'd like to learn more about how we can help you optimize your health, including your blood pressure, we are Northeast Medical Practice located in Great Neck, New York on Long Island. If you'd like to reach the office, 516-604-3418. Online at northeastmedicalpractice.com, through our various social media channels, our YouTube channel, my LongevityMD podcast on Spotify, or simply call the office. Remember, everything we chat about here is for educational purposes only. No doctor-patient relationship has yet been formed, so if you have particular questions or concerns about your health, please reach out to your healthcare professionals. But until I see you next time, be in good health.